Welcome to Tête-a-Tech. For those of you joining us for the first time, we've been having these sessions about twice a week. From day one, our goal at Bay Brazil has been to connect players of Silicon Valley and Brazil, entrepreneurs, tech specialists, and to connect this community and promote dialogue and promote knowledge sharing. We started this series a little over a year ago, and we plan to continue throughout the year to engage our community. So, bem-vindos. I'm very happy that you are joining us. Today, we have 4 Brazilian startups joining us from various regions. And before we actually introduce them, I want to bring our moderator, Antoine Colaco. Antoine is partner at Valor Capital Group and is joining us, is my neighbor, joining us from Menlo Park, California. Antoine has been an amazing friend for Bay Brazil. He brings a lot of experience. Before joining Valor, he was at Google for about 9 years in a series of responsibilities there, including starting operations in India and Latin America. Antoine, thank you so much for joining us. It's with you.
Muito obrigado, Margarese. Thank you so much for inviting us all to speak today, and I believe you'll be collecting audience questions as well, so if people have questions, they can pass them through to Margarese, and we'll try to answer them. And we've already gotten some from the audience, so thank you already. First and foremost, I just hope that everyone on this call and their families are staying well and sane during this unusual time. I know it's been very difficult for a number of people personally and financially, and so we just will hope that everyone is doing okay. We have over 40 portfolio companies right now, and I have to say I've been incredibly impressed with their thoughtful leadership in taking care of their employees and businesses during a time of this uncertainty. So we have 4 of them here today, but I want to say that I've been incredibly impressed by the entrepreneurs we have in our ecosystem in general for what they've done in such a difficult time. So today we're lucky to have 4 Latin American founders who are assisting people, businesses, and governments throughout this global pandemic. And I want to introduce each one of them briefly and then have them introduce themselves more broadly. And I'll let them talk about their companies and themselves. And then I will talk about what they're doing regarding COVID afterwards. So first is Ale Zuzenberg. He's co-founder and CEO of Botmaker. He is from Buenos Aires, and it's okay that we have an Argentine on this call. I know it's Bay Brazil, but it's okay.
We are opening an exception.
We're opening an exception this time. Andreferraz. He is a founder and CEO of Incognia, also known as InLoco, and is originally from Recife, but has moved now to the Bay Area as well. Michael Capps, CEO and co-founder of Vitalk, formerly known as TNH. He's originally from Canada, but is now based in Sao Paulo. And Bira Mercedes is founder and CEO of Sanar from Salvador. So we brought a wide variety of different people from different parts of Brazil and even from outside of Brazil who are affecting the Brazilian ecosystem. So we're very excited to have them all today. You know, if we think about the different aspects of work to combat the pandemic, there's 4 different categories that we think about which are relevant to the entrepreneurs here. There's identification, who has it, where they are, etc. There's medical training and content, helping those people who are trying to help these people improve their knowledge of what to do. There's awareness in the market of what to do, what general population should know and how. And there's screening. How do I figure out if I have it? And so I think with that, this leads into some of the questions I have for some of our panelists here. So I'll start off with Ale. Do you want to please give a brief update on who you are, what you're doing, what Botmaker does?
Absolutely. Thank you, Bay Brazil and Antoine. We are a half Brazilian, half Argentinian company, but really focused on the region as a whole. So very, very happy to be here. Botmaker is an automation platform. We connect businesses and users and consumers on messaging platforms. We help them automate, and particularly we are a WhatsApp solution provider, which allows us to actually connect all these companies, governments, and institutions at large on the largest platform in Latin America. So that's what we do. We offer a software as a service online platform to connect people, automate customer service, sales, and citizen actually service as well at large.
Great. Andre, you want to give a little bit about your background and then what Incognia does?
Okay, perfect. Well, Incognia is a cybersecurity company, but it has originated from another company called InLoco, which is a location technology platform. And basically what Incognia does on the cybersecurity space using location technologies is basically the following. We come from a very simple concept, which is there's no other person on earth that goes to the exact same places as you at the exact same times. So location is a pretty good way to create an identity for users that doesn't need to be tied to who you are in the real world, right? So in that way, we expect to protect people's privacy while maintaining their security on digital services. So an example of this is, for example, if I discover your password from your bank account and I hack into your bank account, for example, we would be able to notice that my physical behavior is different than yours, and then we would be able to block that transaction, for example. Or if I'm creating an account on an e-commerce app, for example, and then one of the informations I disclose is my address information for delivery, we would be able to notice is if my behavior matches to that address, and if not, that's probably a fraudster trying to create an account on that e-commerce. So that's the kind of thing we currently do. And we realized that this technology could also be applied to combating COVID-19, which we could explain a bit more later.
Great, thanks so much. Mike, can you give a little your background and what Vitalk does?
Great. Well, Vitalk sort of plays in a similar space as Botmaker. We love chatbots. We've been building them first on SMS text messaging, since 5 years ago, but we're just focused in healthcare. So, we had a lot of experience building interactive chatbots to educate very large populations and monitor them through text messaging. And traditionally, we did this in a couple areas, in pregnancy and maternity, in chronic diseases. And in the last year and a half, we've just been focusing on mental health. So maybe some of you have heard of some chatbots that you can talk to if you're depressed or you're anxious. Well, we have entire teams of psychologists who build out these chatbots. Now they're no longer an SMS; they're on an app that we have. But recently, with the coronavirus outbreak, there's been obviously a rise in demand for mental health services at a distance. Not only teletherapy, but with using our chatbots. We've been providing that. But then we've kind of gone back to our roots, and we've been called upon by a lot of our old clients, who are governments and insurance companies, to build chatbots specifically around coronavirus identification and triage. Whereby a person could check their symptoms and then be sent to the right place, whether that is to go to an emergency room or do a telemedicine consult. So, for instance, we've been running the Brazilian Ministry of Health's chatbot. So if you go to their website, that's us over there. And we've also been doing it for a lot of municipalities at the local level, where people can text back and forth, and we can sort of navigate them in their specific region, right? So we've had a lot of municipalities, and we're very happy also to work with this guy's companies. It's not going to work. I don't know if you can see, with Ale's companies as well, where we've been working and doing some interesting WhatsApp bots as well. So it's portfolio companies uniting. So that's a little bit about what we at Vitalk do.
That's Mike. Bira, do you want to talk about what Sanar does and your background as well?
Sure. First, it's a pleasure to be here and talk about how we are helping society in this moment. Sanar is a knowledge platform for medical professionals. Sanar is transforming doctors into super doctors. That's the best way to describe what Sanar is doing. We are providing the right content and tools for every moment of their lives. And for doctors, knowledge and information are superpowers. We believe on that. We currently have solutions for 3 stages of their lives. So we have the Sanaflix, which is a Netflix for undergrad physicians, Also, for graduated physicians, have online program for medical residence entrance, and you have the Yellow app, which is a clinical decision-making tool for point of care. At this moment, Sanar are democratizing the content in this space. Our products are up to 10 times cheaper than competitors, and we are acquiring tens of thousands of physicians in our base. So we are generating a huge amount of data on their behaviors to help give better products for them. In the future, we believe you can use that to expand doctors' capabilities.
Thanks so much. So getting into the questions regarding specifically COVID. Andre, in talking about identification, can you discuss what Incognia is doing with your micro geolocation technology to track the contagion? And how do you think about the balance between tracking and privacy? You mentioned that a little bit before, but I know that's something that's always a concern here.
Cool. So the first thing we did over here in, not over here actually, there in Brazil, was to create what we're calling the social isolation index. And the way this was created was basically because we, like this location technology we have, it's way more accurate than GPS. It gets down to like 2 to 3 meters of accuracy. So because of that, we're able to identify like very small movements. Like for example, you just left your house, right? And then this index is basically the percentage of people in a certain area which are leaving their houses in a certain day, right? So we've mapped the entire country, basically created a grid with like 400 meters per 400 meters, and we then extract this index. So then the public authorities can understand how effective their measures in regards to social isolation are in every single place. The way they're using this data is quite interesting, which is basically they're telling they're sending like cars with very large speakers to each region, and they're basically doing big announcements in those regions, asking people to stay home. And we're actually seeing that being effective. So this was the first measure we did, and now the next step.
Andre, who were you partnered with to do that?
Yeah, the first city we partnered with was Recife, and now we're working with over 20 different states. And now finally the federal government started using the solution, as well as we released the data publicly. So if you go to our website, you can see how it works. It's pretty simple. Currently, we only have the data on a state level, but probably this Thursday, we're going to release the version in which we bring the very granular 400-meter grid. So this will be publicly available for everyone, because we understand that also like people could use that information to push their neighbors, for example, to say like, hey, our neighborhood is not doing very well here on this index. We should stay home. We could do better. So we believe also that the people could also leverage this data to push each other to stay safe. So that was the first measure. And the second thing we did is we're releasing a campaign that we're calling it Apps for Good, in which we are making our location technology available for free for any app developer to contribute their data for this project. We're going to delete this data after the pandemic is considered to be over. So it's only for research purposes, and there's no commercial interest in that. So we're going to launch that this week as well. So if anyone here has a large app, we would be open to making a partnership with you. And then finally, speaking about privacy, I'm very concerned about what's going on in several different countries, in which especially telco data is being used to track the movements of the population for a few reasons. First of all, I don't believe that this data needs to be identified. So no one should be analyzed on an individual level. And this is my main concern with the data that is being used in other governments. What we did was, first of all, we don't collect any personal information from the user. So we don't know their name, their phone number, their email address, and anything like that. But this is not sufficient. So the next thing we do is to anonymize the data, especially on data points that if you have knowledge about that person's routine, you would be able to identify that person. So for example, your home address and your work address, those are very sensitive information. So what we do is we obfuscate that information, basically mixing that with random noise on the data, which doesn't affect the statistics, but makes it much more difficult to identify the people. So that's another technique that we use, which is called differential privacy. And then the third thing is the reports that the government and the population are receiving are all aggregated. So there is no individual information over there. We're talking about regions, but not specific devices or people. And finally, providing control for the people. So this is a voluntary process. People are opting in instead of being forced to disclose their data, or even not even being aware that their data is being used for that purpose. So I believe those four things are very important to guarantee the people's privacy.
Thanks so much, Andre. The second category that we discussed was this medical training and content. Bita, could you kind of explain what you're doing to try to help medical professionals who are dealing with the disease and how you're trying to help them now? Bita, you're muted, Bita.
Sure, sorry. First, we need to make an assumption that the problem we face is that all the information in these spaces dispersed somehow, and somehow expensive as well. So we decided to create the best free of charge coronavirus procedural tool. We thought, doctors, you are the superheroes, so I will be your backbone to this battle. So I will give you all the relevant information, knowledge in one place. As I told you, the knowledge is so dispersed in this space. So we are doing three things. One is online classes with the best pulmonologists and infectologists in the country. Second, the best, most up-to-date guidelines for diagnosis and treatment. And third, curated information for the healthcare professionals. For example, scientific research, what is information is fake news. It's so important for the doctors. What is happening inside the hospitals, what kind of conversation they have. What needs to be exposed for everybody. And this information is helping them save lives. Also, we are helping some social organization which run some public hospitals in São Paulo and Bahia, train the healthcare professionals to deal with these situations. So the first dimension, it's helping the healthcare being the backbone for them. It's really important because some of them are really new on this situation, and some of them are really new people. They are young people doing these kinds of procedures in an emergency room for the first time. So we are supporting them with the best free of charge coronavirus procedure tool. There is a second dimension that I want to highlight here that happened, that the university as well have stopped the operation, the operation, and they are facing a really bad moment. As we have all the content for undergrads in our platform, we decided to give them the platform and keep the healthcare students studying. We are offering a free of charge content for university to go through this moment as well.
Thanks, Bita. So talking about our third category that I mentioned earlier was awareness. Ale, you've been working with governments for some time. The government of Buenos Aires was one of your earliest clients. How are you helping them with their current challenges right now?
Yes, so we've been working with governments for some time, and then with the COVID crisis, I mean, it's just gotten a lot more volume and a lot more government. So we're working with some local governments in Brazil. For example, the government in Rio Grande do Sul, Rio de Janeiro, but we're also working with governments in Spanish-speaking Latin America. So we're working with the federal government in Argentina, yes, with the city of Buenos Aires, also with the government in Chile, the government in Peru, and the government now in Paraguay. So the first thing we do is we offer an official verified WhatsApp account for the government in conjunction and in partnership with WhatsApp. And that becomes the mainstream top channel for government to interact with citizens. What it does for them, and I think we have a great case with the city of Buenos Aires, that they launched, for example, a triage to be able to quickly assess if your symptoms indicate a high probability of being sick and seriously sick. So that allowed them to lower 40% the volume in their emergency call center for the government. So that had very quick, very immediate impact. People on one hand prefer to WhatsApp, and they don't have to wait in line on a phone call. So just by adding information, symptoms, contact directly with the government, and actually something that is very important to combat fake news, which is offering them an official channel with government information for the Ministry of Health. All of that, I think, helps concentrate the efforts on the official channels, the right information, combat fake news, and help them with volume and reduce, a huge number of calls. So this is very interesting. For many of these governments, we're also working on their webpage. We estimate that right now we're actually answering over 1 million COVID-related chats every single day. I mean, and it keeps growing, and that's I'm probably falling short in terms of the number of consults. For example, today there was a doodle on Google. There is still going on that talks about COVID, and the first result, it's the government Ministry of Health. So depending when you're in, I mean, the first click on Google on the doodle actually goes right into the chatbot. So it is actually processing a lot of volume and helping unload unnecessary, frequently asked questions and triage questions to governments. But number two, something that's really interesting, we're working with something that's called, in the case of Argentina, it's called Ministerio de la Mujer, which is a specific agency within the government to help home violence and abuse of women, which now with the lockdown, it's actually increasing. So they're seeing the number of calls and need for support. So we're doing that with both Chile and Argentina. This is fairly new. But with this, we're actually also helping unload a lot of the calls and the crisis on domestic violence. And two other things, we developed a COVID bot that has already official OMS and Ministry of Health official information and put that inside of companies. So we've deployed over 60 bots inside large corporations on platforms like Facebook Workplace and Microsoft Teams, so that companies can actually support their employees, especially large companies. And what that does is, in addition to answering information, it's actually providing information about working remotely for the company and providing sort of a quick line to employees on companies with thousands of employees. And last, which it's the one one of the ones I'm excited the most, we're helping small companies. So we've opened our platform for free, including a WhatsApp corporate account, a verified business account API for WhatsApp, and our bots, at least for the duration of the quarantine, to all companies in the region. So if you're a small company, you talk to 5,000 consumers or users every month. At least for this time, it will help you continue selling and continuing doing customer support. So in addition to governments, we're actually giving this for free, at least for the time being, for smaller companies.
That's excellent. Mike, clearly testing has been a major issue in countries around the world. We don't have enough tests. We don't know. I would postulate that the number of cases out there is probably a fraction of the number of people that actually have it, because we haven't tested in a sufficient number of people. What are you doing to help the screening side of things?
Yeah, so I mean, we obviously don't have the physical tests, and unfortunately, Brazil is far below everyone else in the world in terms of having those tests. We're doing a lot of the things that I think Ali is doing in terms of his chatbots. We've been implementing them not just on WhatsApp but on some other channels like web channels. So we're the go-to triage tool for a couple of states, especially in the north, like in Amazonas and in Roraima, and for a couple of cities as well. And we're also, as I said, the tool that's being used by the federal government, the Federal Ministry of Health as well, to do triage. And in fact, we work also with Ali on some specific corporations as well. So we've been doing that. We've been using our know-how to help triage people, to make sure that the people that actually do have a suspected risk of coronavirus are sent, and they get tested, and they can be treated as such. So that's sort of the way we've been attacking the problem. And then I think we've been trying to treat it in a number of different ways, because every single client is a little bit different. So for instance, if you look at the regional level, I think a lot of the municipalities really need to know on a granular level what's going on. So we're building chatbots that triage around a specific clinic, so around a specific neighborhood. So we have a way in which patients are registered. They do the triage and the FAQs and things like that in their specific area. We collect that data, and then we provide that data to the local nurses in that specific clinic. So then they can send in the community healthcare workers, and they can actually test only those people that actually need the proper testing. So we're able to actually act on a local level, and that's a little bit more complex, because we like to deal with a lot of low-income communities, and so oftentimes they internet access may be pretty bad. So we're still using, in some cases, a lot of text messaging. But then we're also looking at, I guess, as a last point, we're looking at sort of an end-to-end solution, right? We don't want to just do a one-time triage. We need to get people engaged, right? And so our angle, as I've said before, we're very interested in mental health. We know that this is an issue, which is, anxiety is going to go up. Well, if it hasn't already gone up, there's social isolation. And so one of the things that we've done is we've taken our app, which has a lot of content about, how do you maintain wellness in the home and things like that. It has, we even have a team of psychologists that you can chat with at a very low cost. The idea there is that we can hopefully use that as a platform to try to engage people and get them to be, continue to be reporting on their symptoms, throughout the whole process, so that, we can catch things as early as possible and get people to treatment and to testing. And in a lot of the cases, and this just to conclude, we are working on some projects with pharmaceutical companies and also other types of very, very large national pharmacy chains that are buying up tests. And so we're able to sort of bring in our digital solution or the physical solution, and try to see if we can get more people tested before to try to curb the spread of this disease.
Yeah, Mike, just following up on that a little bit, Ali mentioned domestic violence numbers have gone up as a result of this, as a kind of an unfortunate additional consequence. Mental health is another thing that people have talked about, and you touched about it a little bit. Are you seeing, I think there's a lot of anxiety about the situation, the uncertainty of the situation, et cetera. Are you seeing indications of that with your work, and what are you doing to address that more broadly? And how do we educate the population more broadly that there are solutions to help people who are feeling anxious these days?
Yeah, for sure. It's a known fact. We've seen the evidence, in various epidemics, SARS epidemic or things like this, anxiety and things like this go through the roof. In fact, Brazil is already the most anxious country in the world. I don't know if you guys know that. It's, double the US average. So now with all this additional stress, physical health and, financial health as well, it just skyrockets. You're getting a lot of obviously anxiety. You're getting a lot of people that confuse anxiety and panic attacks with actual symptoms of coronavirus and ability to breathe. You're getting a lot of post-traumatic stress disorder actually happening. And the problem is, because of the social inequality, it's difficult to access resources, right? A therapy, talking to a therapist is quite expensive for a lot of people. If you want to do regular therapist consultations, that's going to cost you half of the Brazilian minimum wage, and that's tough to do. And so, what we found is a couple of things. We found obviously a huge interest in teletherapy, so that's been growing a lot. It still is, so you have a lot of demand from corporations who want to buy teletherapy for their employees, but that's still a very expensive approach. We found that our digital interventions are just as effective. In the past, we've shown that someone talking to a chatbot over a long period of time, going through breathing exercises, positive psychology and other cognitive behavioral therapy style exercises can actually help reduce. And there's a lot of reduce a lot of these symptoms, subclinical or clinical symptoms. And there's a lot of practical tips and things that we're passing along in a very easy, digestible sort of way. How do you maintain your routines? How do you sleep well? How do you exercise at home? We found that's been actually very, very effective in helping people. So we've had engagement numbers climb significantly. We've had a lot of interest. But it's a complex. Mental health is a very, very complex challenge, right? So an app or something like this isn't going to really fix it. I think you have a lot of structural issues. You don't fix domestic violence with an app. You hopefully are able to identify the critical cases and try to also get them into more intensive treatment before it's too late. So that's a little bit of what we've been looking into.
Thanks. Hey, Andre. Following up on what we were discussing before, some countries I think have done a better job of social distancing and tracking the spread of the disease than others. How do you think Brazil is doing so far?
Yeah, that's a good question. Not very well. Like in Brazil, we've seen a peak on, it was two weekends ago, on the 22nd of March. It was a Sunday. About 70% of Brazilians didn't leave their homes during that day. The day after,
was that when Bolsonaro did he have a rally that day?
No, not that day. 2 days later, on Tuesday, he did a speech basically telling that this wasn't a very big deal. But yeah, what we see is that during the weekdays, about 50% of the population are staying home, and the other half are leaving their homes and going elsewhere. And that's the average. Before COVID, the average was around 15 to 20%. So it has increased significantly, but it's still far from ideal. Ideally, we would be speaking about something between 70 and 80%. So only the people that are working on like the essential jobs right now would be having to leave their homes. So yeah, it's a bit far from where it should be, and it's going down actually. So that's bad.
People staying home is going down.
Yes. Mm-hmm.
Oh, interesting. Wow. Bita, for you, there's several industries which are believed to be experiencing rapid changes as a result of this period. So trends that were happening are accelerating. And one of them has been discussed as education and distance learning and so on. How do you think medical education will be different in the future after this period?
Yeah, I think the main point here is that the world's gonna be different after this. I think the biggest assumption here. We believe that this distance learning will be more prevalent. We are leapfrogging so many years. For example, the Ministry of Education enacted a bill allowing health university to offer online programs, even to undergrad. That is a huge thing for this space. Also, imagine that people are spending 2 months inside their homes learning and change their normal behavior. So we believe even in the healthcare space, online learning will be imperative. There is no other way. We believe that. And you are seeing the adoption in our platforms. We have tens of thousands of users, and the consumption of content in our platforms is increasing 40%, 50% in some cases per user. So I think we are going to find our way to give, including we are going to find our way to give practical lessons to them as well. So we believe this movement will happen soon. We believe that.
Excellent. Ale, I have a two-part question for you. We have one question from Sarah, who's asking if you could describe in more detail how Botmaker is helping women at risk for domestic violence. And then the second question that I was going to ask you was, more broadly, it looks like the public is more open to getting information from governments now through bots and so on. Do you think that this COVID situation will change your industry in any way?
Great questions. So the first one, This is very new. We're working with both ministries, one in Chile and one in Argentina, about this. And the work we're doing is we're helping them implement a whole process for taking in calls and routing them through the right team and providing answers and solutions to people who need support. The processes themselves and the triage. Yes.
Sorry, how do women know how to reach you or how to get to the bot originally?
So this is about to be launched. So we're working with the ministries. So that's why I'm saying this is very new, because it is a partnership with WhatsApp directly. Us as the implementation partner actually doing the bots and providing the service, and then the ministries giving us the processes on what they need. So so they're giving us the entire process on how to treat an incoming call and what are the different decision trees that go below that, depending on what the problem is, how the person is contacting, what they need, and there is a variety of actually things that actually may go to a phone call directly, or just providing support like mental health kind of support, and then it goes to other kinds of support. So this is going to be live very soon. Now, the way this is going to be advertised and people, women are going to know about this is simply because this is official government WhatsApp numbers. So they're going to be publicized on TV, on the radio, online, digital. Facebook is also putting big budgets on credit ads for the ministries to actually do this. So it's going to be out very, very soon. And you know, it's like a second step after actually launching the COVID health related bots and customer service. Just, you know, we provide hybrid solutions. So usually, often, some of those conversations actually are routed to humans who are behind answering the more severe cases. So the same will happen with domestic violence. After an initial conversation, the conversation can be routed to a specialist who can take care of that conversation. We will see those very soon. I will be more than happy to actually post them on my profiles on LinkedIn, on Facebook, and Twitter. And then, but I'm sure that, you know, if you search for any of these two countries, at least maybe more in the future, you're going to find out those numbers, because they're going to be the official government numbers on both. And the second one, sorry, could you just quickly remind me the question?
No, the second question was more around, it seems like there's an adoption of the public to receive information through bots, especially with COVID right now. You're answering a lot of questions through bots. Do you think that this will be a change for your industry in general, where people are more comfortable with that as a means of getting information?
It is. It's accelerating a trend that was already taking place. But people realize that a few things now, that on the one hand, when things require a lot of volume, people are getting used to actually talking to a bot. So on the user behavior, I think there's a trend of actually people accepting talking to a bot. And you know, the way we call it, it's more normal for users to actually learn how to talk to a bot than bots fully understand how humans behave. So it is both ways, right? Users are learning, and it's very clear, you know, in the success rate of the bots that we have, that people understand now how they should talk to a bot in order to get to the answer they want. It's like in the beginning, you know, we had to learn how to search. Now, you know, we learn how to engage with bots, and I think that's happening, and that's taking place. And number two, it's I think companies are realizing that a lot of things can be done with technology, and usually it is a hybrid solution. You know, that's the ideal solution. It's a combination where we call it, you know, the bot is part of the customer service team, or the bot is part of the citizen service team. It is part of the team. It is managed by the team, and ultimately it is there to help you get solutions faster, or to route those solutions and queries to the right person. So absolutely, I see a big acceleration. Absolutely.
Excellent. So one interesting thing is that all four of you have started working together in various manners around the pandemic, and I want to give credit to Carol from our team, who has been very active in trying to help our portfolio come together and work together on this issue. So she was very ahead of the game and thoughtful in kind of bringing all these teams together. But I wanted to ask Andre, can you talk about how you're working with Ale and Mike to help people in the affected areas?
Yeah, so in our case, we are basically trying to provide as much information as possible and open to collaborate to any other entity that needs our data to, for example, make better decisions or to inform the population or decision makers. So yeah, on our side, we're totally open to sharing that data, not only with other companies that are on this initiative, but also, for example, with research institutions like USP and the hospital Albert Einstein in Brazil, and which they are also using our data for example, projecting the infection curve and things like that. So yeah, we could serve at this point as a data provider to all of the other companies here. Sure.
Great. And Mike, how are you leveraging some of Bira's content in your product?
Well, we haven't started yet the partnership, but for instance, we have a strong strategic partnership with Johnson & Johnson, right? And one of their strategic initiatives as a company globally is to focus on what they call the so-called the resiliency or the mental health care of frontline health workers. In other words, the workers that are, the nurses, the community healthcare workers, and doctors that are on the front lines of healthcare. And this was before coronavirus, right? So now with coronavirus is even further amplified. And so, one of the things that we're looking into is we're slowly building up a platform with some resources for them, and then very, very shortly we'll be calling on Bira to put in some of his content as well to help educate them about proper practices and things like that, because I think for them to be able to treat their own mental health, they need to know how to deal with the onslaught of demands from patients and know how to the correct protocols. So that's a little bit of what we're thinking of doing shortly, and there's not just one type of a partner that we've been working with on this. There's been a number of other ones that have also expressed interest in getting the frontline health workers up to speed.
Excellent. And Bira, how are you ensuring that you're getting the most updated content to share with your medical professionals? Because things seem to be changing quite a bit. There seem to be a lot of rumors about what works, what doesn't work, etc. How are you collecting the right information for the physicians out there and nurses out there?
Yeah, that's a great question, because a lot of healthcare professionals ask us the same question. So we get the most reliable information from the global scientific community and from our internal user as well. And we have a three-process operation for that. One is you are using technology to get this information. So you have crawlers to extract it from the scientific community websites. For example, the World Health Organization, the National and the State Department of Health as well in Brazil, private institution like Johns Hopkins. So use these crawlers to get this information as quick as possible. The second is our community. So we have a huge user base in our communities, and they are producing content. These doctors and people that is in this battle is producing content all the time. These contents are mostly opinions, articles, and anecdotal reports, because they cannot do it like the formal knowledge for the community. So, but they can give opinions what is happening inside these inside hospitals, for example. And three, have high-level doctors from Brazil, as I told before. So we have these physicians who are teachers from Sanar, who constantly update the content in our app or in our platform. So is that the 3A that we are doing to make this content really up to date and reliable for community.
Excellent. So now taking questions from the audience, we've gotten some beforehand and we're getting some right now. There's some interest, Andre, seeing how you come from Recife. How did you go from Recife to Silicon Valley? What were the sources of funding? How did you build a business from there? What was the trajectory that you had?
Yeah, I'd say that our trajectory of funding wasn't the usual, like angels, then a Series A, then a Series B, and all of that. We actually did a seed round after almost 4 years working with no funding. The seed round was led by a corporate VC. And then after the seed round, we did a Series B about 3 to 4 years later. So yeah, it wasn't the usual path, but so far so good. Now we were able to bring the company up here to Silicon Valley, and yeah, now the challenge is pretty different, exporting a technology from Brazil to the US, which is not the usual path as well. So yeah, that's basically the moment we're in now. It's getting the first few customers here in the US and proving that the technology we've built is not only for the Brazilian market, but is a technology that tackles global problems.
And a question that came for, and it's kind of for all of you, and please chime in with your thoughts. How have you had to change your business model for the current time, and which of those do you think will be permanent changes? And how are you helping your employees through this process? And how do you see the government impacting your business today? So 3 different questions, and I'm sure you'll each have different answers. So who wants to start?
Yeah, well, maybe I could start here. Yeah, there was definitely a big change. We had 2 different products on top of the location platform. One was an advertising solution that used our location technology to track foot traffic in physical stores. So basically, most of our customers were physical retailers that were trying to generate foot traffic on their stores through mobile ads. And then the other product was the fraud prevention and authentication solution based on location technology. Well, the first business basically melted. We've lost almost 90% of our revenues. We had to do some pretty big changes on the company structure. At the same time, the business on the authentication and fraud prevention side, it's thriving because fraud is spiking very significantly right now. Most hackers, they now have more time because they're staying all the time at home. So this is becoming a big problem for banks, e-commerce, and payment companies. So on the other hand, we're seeing growth on this business unit. So right now, what we're doing is basically repositioning the company and putting all of the resources on the areas of growth, while on the MarTech and AdTech solution, we are actually using it for the battle against COVID, opening it for free, and actually transforming it into a product for the developer community. So yeah, it was a pretty big change for us. At the same time, it has accelerated a plan that we have already. So at least we didn't have to change the strategy very significantly. It was only, we were only forced to do it faster than we expected.
How about Mike?
Yeah. So from our side, in terms of our company, I mean, we had very specific goals that we want to work on our product, and we were working a lot on, our product and testing different things here and there. And then we had this opportunity fall in our lap, which was sort of give a pause to what we were working on and focus on these opportunities, because we saw a window to build relationships with clients that we could potentially work with in the future, like, the Ministry of Health or states or other companies. So we sort of paused. We said, guys, there's a revenue opportunity, also a giant impact opportunity. So we started working on things related to that, building, bots just around coronavirus. And now we're sort of shifting the boat back into the direction of mental health, which was, our strategy beforehand, and sort of interweaving coronavirus into that. So it's been a very nice transition in terms of, what we were going to do. And we think that actually this situation is going to be very, very positive for our company. I think on one side, people are recognizing the importance of mental health. Companies that, before skirting the need to pay for that for their employees. They're seeing that it's actually very, very important. I think people are beginning to realize that as well. And then also there's been changes as well. The National Regulatory Agency for Psychotherapy and for Telemedicine, have allowed now fully for you to do a lot of things remotely. So that's on the regulatory side. This helps us out a lot in a certain sense. I think people are recognizing as well that remote therapies or mental health care treatments are effective. And we think actually in our side, given that we're positioning ourselves as a low cost player, so we say that we're 5 times cheaper than a regular, teletherapy or regular therapy consultation. We're going after sort of the more middle low income populations. Well, we think that with the recession, that may come, or with the economy the way it is, that'll hopefully accelerate things, or people will try to switch over to our solution. We'll see if that actually happens. So that's what's been going on with our company, with our strategy. Obviously, a lot of our projects, some projects that we were implementing had to get paused. Companies are not, have other priorities right now, but we think that in some cases it's a short-term kind of thing. We've been able to substitute it with other stuff. And then internally, what have we been doing? One of our big values as a company is the wellness of our employees. That we're a mental health care company, so we've been treating everyone very, very well. We've been trying to practice what we're preaching in terms of some of the techniques, and so we have a lot of rules that we've built in about respecting people's time, and we have sort of mini group therapy sessions that are rolling. We have so many psychologists on our team full time that are helping us sort of weather the storm. So I think the company, we've been able to get people motivated. And I think, we've been blessed in that opportunity where we haven't had to restructure at all, right? And so I think, just letting people know that, look, guys, for now, your jobs are protected. Let's stay focused. And you got to work this weekend. You got to work this night because the demand is there, right? So, yeah.
Thanks. Bira, how about you?
Yeah, we really had a stroke of luck because the situation has enabled us to both help society and increase the level of trust of our user base. You just need to maintain, you decide to buy time because that is a new time for everybody, a new situation for everybody, but maintain the core business work. So we postponed all the investment whose returns weren't so clear and focus and fortified working products. But actually, the smartest thing I think that we have to do is try to respond quickly to any situation. That is better that's better than any plan you can do in a Black Swan event. So we are trying to respond so quick, and every day we are like in the front line of the business, trying to get all the information to see what is happening. Secondly, even though we are in a good position, we have set sensors for us to enable a hard contingency plan as well. So that's the side part of the financial side part of the business. In last but not least, we saw some opportunity emerging. That is important to say. Some of them are unique for us. For example, the standard operational modes of one of our biggest players, competitors, is being affected by the coronavirus. So although we hadn't planned on combating them this year, we want to take advantage of this moment, and we are doing like a big market campaign to increase our market share position now. So I think it's the whole picture what we are doing about that.
Thanks very much. And lastly, Ale, how is this affecting you from a
Yes.
business perspective?
So two perspectives. One is from a sales industry growth perspective, health and government coming to the front in terms of growing there and the size of the opportunity. But mostly, I think we've had to turn upside down our model and again give away our platform for free for the time being to really help out companies, and that is proving to be also probably a good business decision that we might sustain or tweak a little bit over time after the pandemic. or with life after quarantine, let's put it in that way. Yes, I mean, from charging a setup fee upfront for companies to spend their time on them, we've turned it upside down, and now it's fully free. You can get a WhatsApp account with an API, a WhatsApp API account, and the Botmaker platform for free. Use it, test it, try it out. Just you need to put a credit card to validate identity, which is required for WhatsApp. But then after that, we're sure that's going to change our business in many ways. And just one example, since we opened the platform last Friday, we've been getting, tens and tens of new accounts every day. And then half of them are coming from, outside the region in English. So it's accelerating our English language business, which was growing, but it's now growing much faster. But it is an investment for the future, of course. And then I think internally, I mean, this is definitely changing our company. We probably will never go back to a 5-day a week office environment. We've always been very flexible with our teams and allowing people to stay home if they want it. But really, this is going to change the office. I think we're going to go back to the office being really a team place rather than an individual contributor place. And we're seeing engineers working, very, very productively and efficiently from home. And that should really be an everyday choice to go to the office. I don't think we should go back to just spending 1 or 2 hours a day commuting. I mean, it was out there before, but now I think it's absolutely proven. I don't see us going, fully to the office again.
Well, thank you. I think we've run out of time, but so to everybody, to Ale, Andre, Mike, Bita, thank you so much for your time. I hope everyone is staying safe and sane in these turbulent times. And Margarisi, thank you very much for having us, and we look forward to the next one.
Thanks, Margarisi.
Thank you, Antoine. Thank you, all the founders. I'm very impressed how quickly you are adapting your business and helping people out there. Thank you for that, and much success to you. Obrigada, Antoine.
Muito obrigado.
For your help in putting this session together. And obrigada, everybody that is joining us. Friday, we continue this. We'll have another chat. And if you like, please share this with your friends. And let's keep the dialogue going. Obrigada. Tchau.